Today we're going to talk about when would be a good time for your daughter to have her first visit to the gynecologist. The American College of Obstetrics and Gynecology recommends an initial well-woman visit for teens and adolescents at around 13 to 15 years of age. The goal of this initial visit is to start to build a physician-patient relationship for the future, to dispel myths and fears about visiting the gynecologist, and to work towards trust toward a future relationship. So when we first visit the gynecologist, it would start like any other visit to your pediatrician or your primary care doctor. Now, the next part of the visit is something that may be different than you have with your general practitioner, or something that may be different from what patients have had before, and that is the importance of having a confidential visit. This is where we really need to know that we're growing as an individual, that we're having time to discuss our own personal questions with our physician, and that we do have time to discuss things that we might not feel as comfortable discussing in front of our parents. The next part of the visit that may cause some anxiety for patients is the idea of a gynecologic exam. First thing is, we do not have to do any part of an exam if that is not comfortable for the patient. The most important part of your first gynecologic visit is education and learning and developing a relationship with your physician. The last part of the gynecologic visit would be the wrap-up. At this point, any patients who had elected to do their gynecologic exam by themselves, we would bring the parents back into the room. We would talk about what we had went over in the visit and assure that everyone was in understanding of what we had talked about. At the end of the day, we want to make sure that visiting the gynecologist can be a positive experience. Our goal is to make sure that girls can come away feeling educated and empowered without fear of visiting the gynecologist.